overall world the cancer incidence are increasing, and definitely in India because of definitely what is our lifestyle has changed, our environmental factors are playing role, and it is a Globocon data which suggests that by 2040 there would be a 50% rise in the cancer. All the drugs, all the research moleculars are built in the western states. Researching means in India we don't have that much facility to research for a newer molecule. Even in the, if you go for a movie, they are just showing that tobacco is injurious. Yes. Government is doing their work, but implementation, applying it, means it would be come to an individual. Basically in cancer, multi-factors play a role.
Okay.
And air pollution is definitely one
of
the
factors.
People are so scared, and so many myths are associated with biopsy, because everybody says like if once a biopsy is done and the cancer will spread, which is a total myth. Like awareness programs should increase, screening programs, camps should increase to the ground level.
Doctor, thank you for speaking with us. Let me begin with the big question. Why is India witnessing such an explosive rise in cancer cases, especially among younger people? Are we doing something fundamentally wrong in terms of prevention?
Okay, so it's not only about India. Overall world, the cancer incidence are increasing, and definitely in India because of the lack of awareness, we are often finding it difficult to start prevention, and the detection rates are low because patients are not aware of the signs and symptoms. So why is it happening? It is because of definitely what is our lifestyle has changed, our environmental factors are playing role, and it is a Globocon data which suggests that by 2040 there would be a 50% rise in the cancer.
Okay.
So it's not pertaining to India, it is all over the world. Okay. But definitely we are also ranking high in the cancer incidences.
Okay. Despite multiple national screening programs, most cancer patients in India still reach hospitals in stage 3 or stage 4. Is this a failure of system, a failure of awareness, or both?
So I would like to say it is a failure on everyone's part. As an individual also it is a failure. Okay. So awareness first. You don't know about the thing, means you don't know what is the signs and symptoms of cancer and how we should proceed to that. Means if you are suffering from symptoms and you ignore it, it can be either due to lack of knowledge, or it can be due to the myths which are associated with cancer. Because if you see, many patients, they are apprehensive. They say once the cancer is diagnosed, then the life will be over. It is the notion of most of the patients which we are actually finding in OPD. So they are so much worried. So that is the most important point. Awareness is one. Second, yes, sometimes what happens, like people, they share their own personal events, like their own personal experiences about cancer, and every cancer is different. So what happens, the other person, like the listener, will think, oh, she has gone through this, these are the negative points, okay, because of the treatment, these are the complications she has faced, might be I also will face the same. So every individual has a different cancer, and every individual has a different treatment for that is called as personalized therapy. Okay. So this is what most I would suggest, that most important part would be a failure on everyone, like be it a government, be it individual, like awareness.
Symptoms are same, or even patients have different symptoms?
Different. It can be different for the
different patients.
And different cancers also.
Okay, families often say that first PET scan biopsy and initial treatment cost wipes out their saving. Why is cancer treatment still so unaffordable in India, even with schemes like Ayushman Bharat?
Yes, see, I would suggest, like, if we go back to 10 years back, then this question would be a valid. Nowadays, see, PET scan and everything, it has the change. When it came into India, it was costly. But now, because multiple institutes are there who are doing the PET CT scans, and that is the demand ratio, supply ratio. So the cost has been decreased.
And when it comes under Ayushman Bharat, so
it is more affordable.
Further more affordable.
So nowadays, though, like slowly, every hospital is taking up the Ayushman services and all. So definitely, it will reach out to more people, and it will be more affordable in the near future.
Is India adequately equipped to handle the cancer burden?
Right now, because if you see, the policies are also directed towards the cancer awareness and cancer treatment. Even the doctors, means like even the PG seats, super specialty seats have been increased. This is to target for by the vision of by 2040, if we are thinking that the cancer risk will increase by 50%, so we will be sufficiently equipped with the doctors, staff, and the treatment, and then we can provide the better services to the upcoming hazard.
Okay, do we have enough oncologists, radiotherapy machines in specialized centers, or are we staring at massive shortfall?
See, it is concentrated. If you see in the 2-tier cities, it is less. Definitely in metros, radiotherapists and medical oncologists, surgical oncologists, they are sufficient enough. But we are definitely 2-tier and 1st-tier cities. We are still lagging. It's not gone to the rural places also.
Okay.
It's required. It is a big setup is required for a radiation machine and everything. So definitely in other cities, I would say there is a shortfall
of that. Yeah. Okay. There have been repeated shortages of essential chemotherapy drugs in India over the past few years. Why does this crisis keep happening? Is it a manufacturing issue, policy failure, or profiteering?
In the private sector, I don't find any shortcoming in that shortage of any chemotherapy drugs. Definitely, I would say that all the drugs, all the research moleculars are built in the Western states.
Okay.
Right. So, in the research purpose, yeah, we are lagging.
Okay.
We are not researching. Means in India, we don't have that much facility to research for a newer molecule. Maximum molecules comes from the Western countries. So, usually the drugs have the patency. Whoever is researcher, and when the patency is over, then only it is more affordable to the other country, developing country patients.
Right. Okay. Tobacco accounts for nearly half of all cancers in India. Yet enforcement of tobacco law remains weak. Do you feel the government is serious enough about tobacco control, or are we losing the fight?
Laws are there, but the implementation is not there. We make law. Definitely, they are focusing on the, you see in the cigarette packets, on that they are imposing
Statutory warnings are there.
Yes, warnings are there, and they are just posting the pictures also. Even in the, if you go for a movie, they are just showing that tobacco is injurious.
Yes.
So government is doing their work, but implementation, applying it, means it would be come to an individual.
Right.
So it is like a
to follow it or not follow
it,
right?
Yes.
Okay. Okay.
But definitely easy availability is there.
Right.
Like in this is my personal opinion. In Western countries, you would see like a liquor shop is means you have a dedicated liquor shop.
Right.
Similarly, you have a dedicated tobacco shop, and it is confined to that. Then there would be a checkpoint like minor should not be given. So these should be implemented.
Yardsticks are there.
Yes.
We are also seeing more non-smokers being diagnosed with lung cancer. Is worsening air pollution a direct contribution? How worried should Delhi and other metros residents be?
Yes, definitely air pollution is also one of the important factor playing role.
How important is that?
I would say it is an important factor. So basically in cancer, multi-factors play a role.
Okay.
And air pollution is definitely one of
the factors.
Yes.
Okay. There are frequent reports of misdiagnosis and unnecessary treatments, especially in smaller private hospitals. How widespread is this problem? Is the lack of standardized treatment protocols putting patients at risk?
So I would say I would not concentrate on small private hospital. I would say in the means like in the 2-tier, 1st-tier cities, if you see in the rural services, because there are limited investigation options. Okay, so the diagnosis is often missed. Sometimes the expertise is not there. Okay, you need a dedicated oncopathologist. You do a biopsy, oncopathologist should be there. So it is different from the pathology. They should be specialized seeing the cancer cells. So the first point is important. So then only you can proceed with the treatment. So I would not say that in the small private hospital. Yes, I would say in periphery, we often miss the diagnosis, not because of the lack of caliber, because of the dedicated services are not available there.
Okay. Cancer is not just a disease of the body. It destroys families emotionally. Do Indian hospitals provide enough psychological and palliative support, or this is still completely ignored in our system?
Many of the institutes which have a dedicated onco center like ours, so we have onco psychologists. Okay? They are dedicated. They counsel the caregiver, they counsel the patient, and it is very utmost important part, because cancer doesn't affect the only cancer patient. It involves your full family members. All the family members are involved. financial burden,
Right.
psychological burden. It involves everything. So
Right.
definitely we require a psycho-oncologist. And in the dedicated centers, you have a onco centers. It's not like only surgeon is available, only medical oncologist is available. That is not a dedicated center. You should have all the things under one roof. Those centers actually have psycho-oncologists.
Okay. From your own practice, what is the most disturbing trend you're seeing today? Something that keeps you awake at night?
Most disturbing what I feel, still the awareness is not there. Many times it's very hard for me also to convince the patient to get a biopsy done.
Okay.
So people are so scared, and so many myths are associated with biopsy, because everybody says like if once a biopsy is done and the cancer will spread, which is a total myth. Okay, and it is a most important part for the diagnosis and for the treatment purpose. And if we don't do that, and patient will not end up with the treatment, and they default it. So this awareness is not there, and so many myths which are associated.
Can you share some case study where you must
Yes,
have...
I remember. See, breast cancer, usually we say it has a very good prognosis.
Right.
So I always push take a biopsy, because breast cancer have 3 types of tumor. It can be hormone positive, HER2 positive, triple negative positive. So that can only be diagnosed on the biopsy sample.
Right.
So if we are not doing it, then we will not be able to proceed the treatment. So that female came to me, and I remember 5 years back, I counseled her we should take a biopsy. She was like, no, because it will spread, I don't want to do a biopsy. And she went to alternative medicine. I'm not saying they don't work. Definitely it's different.
But biopsy is very important thing in cancer.
Biopsy is very important. And then she came back after 2-3 years, and then she told me that size has increased, and now she is having pain. Again I counseled, biopsy was done, and now she has taken the treatment, and she is actually cancer free right now.
Oh, that's wonderful.
So because it was hormone positive, it had not spread to other organs, because it's a little bit better prognosis.
Right.
But had it been a triple negative or HER2 positive, it would have spread all over the body.
Okay.
So once she felt no, it is not, the alternative medicines are not working, then she came back to me.
Okay.
So good for her, that hormone positive tumor, that we could treat her.
And finally, doctor, if you had the power to fix one thing in India cancer care system right now, what would it be and why?
To fix, I would suggest, like even in a small setups also, like whenever patient comes to an OPD, just a small gesture, just examining the patient, even as a cancer screening. Ask the symptoms, correlate whether we have a cancer or not, whether this patient can be a suspicious cancer or not. First step in that. Second, I would suggest like awareness programs should increase, screening programs, camps should increase to the ground level, not to the cities where already patients are literate, people are literate, to those where rural.
So you mean to say the rural area,
yes,
government has to reach there?
Yes, to the end you should reach.
Tail end.
Yes, then only it will improve. Okay. Otherwise, still you concentrate on the educated population, it will not change.
Okay. Thank you, Dr. Pallavi Redhu.
Thank you.